Good morning and welcome to Beyond the Headlines on CIUT 89.5 FM. I am your host, Mina Zaheen. Beyond the Headlines is a weekly current affairs show that aims to make public policy discussions more accessible to you. We take you beyond the headlines of our daily news, bringing you access to current leaders through in-depth interviews. You can join us in the conversation by tweeting at beyond_headlines. That's BYOND_headlines. On today's episode of Beyond the Headlines, I will be sitting down with Allyson Theodorou, Operations Director at PeerWorks. We will be discussing mental health and addiction issues, the role of peer support, and Ontario's Roadmap to Wellness. Ontario has launched a new initiative called Roadmap to Wellness, which aims to develop a comprehensive and connected mental health and addiction system for the region. Over 1 million Ontarians face mental health and addiction issues each year, and the system faces challenges including long wait times, service fragmentation, and lack of evidence-based funding. The initiative will include investments totaling $3.8 billion over 10 years, funded in part by the federal government. The plan is to make high-quality mental health services available throughout people's lives, with the right level of care accessible where and when it's needed. The plan will require a whole-of-government approach and investment in services from partner ministries, including Children and Community and Social Services, Municipal Affairs and Housing, Solicitor General, Education, and Indigenous Affairs, among others. The initiative has been developed over a year of consultation with hundreds of Ontarians in communities across provinces, including grassroots community organizations, healthcare providers, experts, and advocates, as well as people with lived experience of mental health and addiction issues, their families, and caregivers. There was broad consensus that upstream investments in areas such as early intervention and investing in community-based services is the best way to achieve success. On today's episode, our guest is Allyson Theodorou, Operations Director at PeerWorks. Allyson began working for PeerWorks back in 1993 in its earliest incarnation as the former CSDI. Originally tasked as an administrative assistant, she has taken on other responsibilities including office finances, conference organizer, and working with graduates of the PeerWorks Peer Support Core Essentials program while they complete their internships. She is certified with Peer Support Canada and is qualified to deliver PeerWorks Peer Support Core Essentials program training. Hey, Allyson, thank you for being here with us today.
Thank you for having me.
So let's get started. I want to start from the beginning, 1970s and 80s. There started to be this, shift in mental illness recovery, and there was this new vision for how that was going to look. And so can you tell us a little bit about what was happening at that time in Canada?
Yeah, for sure. I mean, I think a lot of it did start in the 70s and 80s, but also I think it actually started more in the 60s where people started to also kind of start to, I don't want to say fight back, because I don't know if fight back is the right word, but I think that they started to recognize that there were other supports that could be put in place instead of having people with mental health and addiction issues institutionalized.
Mm-hmm.
So there was a shift, sometime between the, it's like I say, started probably in the 60s, but more in the 70s and 80s, where they started to look at being able to treat people with mental illness, not so much in hospitals, in psychiatric hospitals, but more potentially in general hospitals or by their own family doctors, or also by community mental health supports.
And so this process was referred to as deinstitutionalization. Is that correct?
Yes, it was moving people out of necessarily not being institutionalized, but being brought into the community and the supports being provided to them in the community, as opposed to being in a hospital.
Okay, so does that mean that at that time the hospitals were shutting down?
So some hospitals did shut down, but I think what they also did is they also wanted to use those hospitals for more specialized and more complex services, as opposed to anyone who may have been having mental health issues being hospitalized, that they wanted to recognize that not all individuals that were suffering with mental health issues needed to be hospitalized, and that some could be treated in the community, whether it be, like I say, with their family doctors or with their local general hospitals, or, like I said, community supports.
Mm-hmm. So I went to school in this small town in Massachusetts where that happened later on. But what ended up happening was that individuals with mental health and addiction issues actually ended up on the street and were unhoused. Did Canada experience something similar as a result of like the institutionalization?
To be completely honest, I'm not 100% sure. I do know that what also came out of during that time was the need for more supportive housing.
Mm-hmm.
I don't want to say that there wasn't an increase in people being unhoused, because I don't have those statistics, but I do know that that was something that was considered, and that there were housing supports and housing made available at that time as well.
Okay, wonderful. So this is where peer support comes about, right? So this is where the idea of peer support was born. So can you tell us a little bit about how it all began, where it began in Canada?
So I can speak more to Ontario, because every province has their own kind of history of peer support. Some provinces definitely are more ahead than other provinces. Ontario is, I think, one of the provinces that is a little bit more ahead than others. So I can definitely speak a little bit more to Ontario, but that there are peer support organizations and practices happening across Canada. I'm just not as aware of all of the ones in Canada as I am more the history of Ontario. In Ontario, in the late 80s, there were a couple reports that were produced from the government, one called Toward a Shared Direction in Ontario, as well as one called Building Community Supports for People. And that one, a lot of people refer to as the Graham Report.
Mm-hmm.
And then from those reports, funding was directed to the first Consumer Survivor Initiative, and that was in 1991. So that would have been the Consumer Survivor Development Initiative, which at that time was a provincial organization that was developed to help provide direction to determine funding for smaller consumer survivor initiatives and projects across the province. So the Consumer Survivor Development Initiative, basically, I guess, in conjunction with the government, put out a call for proposals where organizations could put in proposals to receive funding. Mm-hmm. So that organization was started in 1991. Mm-hmm. By the middle of, I think it's around the middle of 1991, funding decisions had been made to support 42 programs across Ontario. Mm-hmm. And the interesting thing about those 42 programs were they were what we called consumer survivor initiatives, meaning that they were run by people with lived experience. They were for people with lived experience. They were governed by people with lived experience. Mm-hmm. And that initial funding was a one-year program. And the idea was to have people with lived experience supporting other individuals with lived experience. Some of those programs were actually businesses or like, as we call them, economic development, where people with lived experience who maybe weren't in a position to be working a full-time job, or maybe even sometimes a part-time job, could go and give back and work a little bit while getting support for their mental health and or addiction issues. And then some of those programs were drop-in centers, social recreation programs. There were lots of different programs that were offered through those organizations. And then in 1992, through those organizations, there was 81 full-time employment positions that had been created by those projects. And I think, and when we say full-time equivalent, because not everybody was working full-time, so there's over 300 people that were employed from that program. Some did continue after that first year to receive funding. And then in 1993, the Consumer Survivor Development Initiative, which was like the umbrella organization, they were fully operated by people with lived experience. And from that, the government recognized how important the Consumer Survivor initiatives were. And in 1996, they released an additional $23.5 million to enhance community mental health. Now, not all of them were, as we call them, Consumer Survivor initiatives. They weren't all completely run by and for people with lived experience. Some of them were in programs of larger mental health agencies, but it all provided a level of peer support.
Okay, thank you for that background. So Consumer Survivor Initiatives, as you referring to them, they are organizations that are run by people with lived experience. And what you mean by that is people who have experience with a mental health and addiction issues, correct?
Yes.
Right. And so the idea is that people who have this lived experience can better relate to others who are currently experiencing those issues, and they can provide a kind of support that others might not be able to.
Yeah, like the idea is that, you know, being able to receive support from someone who has been there, done that, someone who knows what you're going through. Now, we never say that anybody knows exactly what anyone is going through, but when someone has struggled and they can go in and talk to someone who knows similarly to what they've been going through, there's a different sense of understanding and belief, and also a comfort level. Like, there's a comfort to know that who you're talking to can relate to the experiences that you are going through at that particular time in your journey in your life.
So before the government got involved and started funding these initiatives, there had to be some kind of a presence. There's had to be some people who were already forming these support groups. So was it that the government came in first, or is it that these people with lived experiences started helping out each other and then the government kind of took notice and also stepped in?
Yeah, I think peer support predates any government funding. I think that what happened, and this is going back probably again to like the 60s, 70s, 80s, where people with who had been institutionalized started to come together and support each other in their experiences. There is something to be said for, AA or NA or some of the other, support groups out there that a lot of people say was the beginning of peer support. We talk about the fact of, peer support, but peer support didn't begin with the funding of peer support organizations. Peer support has been happening for many, many years beyond that funding.
Exactly. So I remember watching a video about, in the very beginning, how peer support came about. I believe this was like a CSI where the people, they came together, they actually bought a house in which they live together. Does that kind of model still exist, or is that more of a thing of the past?
So I think I know which organization you're talking about. And there are organizations that have purchased property, have made it kind of like a home. Normally, some of them will have some apartments or, where people can stay if they need to, but mostly they're just run as organizations, drop-in centers. But to some people, it is like a home. Because a lot of these organizations are also having people that come in that have either fallen through the cracks. Maybe they're people that have had a bad experience with the traditional mental health system and don't want to be involved with the mental health system. The one nice thing about peer support and peer support organizations is it's completely voluntary. There is no referral. Nobody can tell you have to go for peer support. You can go for peer support. You can walk into an organization and provide support, and you can leave and go back the next day, or you can leave and go back a month later or 6 months later. There is no wait lists. But also too, in a lot of the cases, is these peer support organizations are providing, in some cases, showers for people who might not have access to regular showers. Or there might, a lot of them will provide meals if they can throughout the week, for people who might not have access to healthy food all the time. So they are, for some people, kind of like a home. It's their family.
So I think earlier you were referring to the CSIs that are run by and for people with lived experience, but you're also talking about how peer support can be a program that is run by like a bigger organization. Can you tell us a little bit about that and how exactly that works, especially when it comes to like these bigger organizations having peer support programs?
Yeah, so I mean, there definitely is different types. I don't want to say different types of peer support, because it's not different types of peer support, it's different organizations. So you've got, on one hand, you've got your consumer survivor initiatives, which are independent organizations that are run by and for people with lived experience. They are different in some ways, but then there's also peer support programs that are very successful and very, within CMHAs, within other community mental health agencies, within help teams. So depending on what it is that you're looking for in the community that you're in, you might find a CSI. Unfortunately, there are not a lot of consumer survivor initiatives across the province. As I mentioned, I think we started in 1991 with like 42. And of the actual consumer survivor initiatives, there's maybe about 10 left. Now, some have just, gone in and divested and become a program of other agencies. So the peer support is still being offered, but it might be just being offered through another program.
And you're the operations director of PeerWorks. Can you tell us a little bit about PeerWorks and how that fits into this picture of peer support in Ontario?
Yeah, for sure. So I think the first thing that I probably should mention is that PeerWorks was formerly the Ontario Peer Development Initiative, which was formerly the Consumer Survivor Development Initiative, which I mentioned at the beginning. So our organization actually has been around for over 30 years. We were involved in determining the first consumer survivor initiatives that were going to receive funding back in 1991. And, our role has evolved over the last 30 years, but currently our role is a provincial, almost like umbrella organization for consumer survivor initiatives, peer support organizations. What we do is we advocate on behalf of consumer survivor initiatives and peer support organizations for more funding. We want to bring awareness. We want people to know about peer support and peer support that is available. It is our vision that peer support will be available to anyone and everyone. readily available and accessible to anyone who needs it. That peer support will be available in colleges and universities and high schools and workplaces, because, there really isn't anywhere where we can't all benefit from having someone to talk to from time to time, and someone who might be able to share with you their experiences and understand. So in addition to us kind of advocating and bringing more awareness to peer support, we also have a training program where we provide training to people who are interested in becoming peer support workers. We also, for our members, have communities of practice to bring people together to talk about, common problems or things that they want to talk about or share ideas. We offer webinars widely out to the peer support community, and are just available to our members and to the broader community when they're looking for information on peer support and where to find it.
Okay, amazing. So earlier you had mentioned how PeerWorks is involved in helping organizations get funded, but you're also, funding is something that has come up a few times throughout this conversation. And so I want to talk about the Ontario Roadmap to Wellness, which is the Ontario government's, kind of plan for how they want to address mental health and addiction. And they've been talking about this $10 billion in funding that they want to provide to different organizations. And peer support is something that is definitely mentioned in this roadmap to wellness. But can you talk to us about funding for peer support organizations and how that might have actually decreased over the years, even though, as we can tell, this kind of like mental health epidemic is getting worse and worse. So can you just talk a little bit about the roadmap, where peer support fits in, the reduction in funding, and how that's impacted your ability to do your work?
Yeah, so I guess the first thing I would say is, like you mentioned, the roadmap to wellness is the government's plan or their guide, and it really is to build a more comprehensive and connected mental health and addiction system. So one of the challenges that the roadmap to wellness is trying to combat is long wait times. Now, I'm not saying that obviously peer support can't reduce wait times. What peer support can do is it can be an option for people who need support while they are waiting for other services. So I definitely think, and I know that the government has and is investing in more peer support programs, to help with this. We're not exactly sure. It's unclear to us exactly how much money is going to peer support. Hopefully, we are hoping that some of that money that is earmarked for peer support will go to consumer survivor initiatives and peer support organizations, as well as we are hoping that, we have been asking for an increase in our budget as well. Our budget was reduced a number of years ago, and part of what we are hoping is that by increasing the budget of our organization, that is in turn going to provide more support to our member organizations, which will free up time for them to provide more direct services to their organizations. We did say that with some of the CSIs that were originally funded, there aren't as many CSIs left. But the reason why there isn't as many CSIs is because some organizations have gone under the umbrella of a CMHA, whereas now they are just working as a program of the CMHA. So there are peer support organizations still embedded into CMHAs, like I said, which I should probably point out that CMHA is the Canadian Mental Health Association, which has, like I say, a national office, and then provincial, and then local So when we say CMHAs, there are local CMHAs all across the province.
And while, of course, it is great that, there are peer support programs at CMHAs, one of the things that, makes CSIs so special is that it's run by the people, that have the most intimate experience with these issues, and for people struggling with mental health and addiction issues. And it also it's more empowering to the community when they have more hands-on and more of a say in how the organization is run, I believe.
Yeah, I mean, there's definitely a difference with a consumer survivor initiative and a peer support program that runs out of another larger agency. That, like you said, Mina, definitely the difference is going to be that, within a CSI, the staff, the board, the members, everyone is someone with lived experience. Within a larger peer support program, the peer supporters and the people utilizing the service are going to be people with lived experience, but the entire agency is not always made up of people with lived experience.
Mm-hmm.
So definitely a little bit of a difference there. However, regardless of where you're getting peer support, your peer support should always be being provided by someone with lived experience.
Mm-hmm. So you're talking about these organizations that are almost like a home to these people at times. Can you talk a little bit about the different ways in which these organizations can provide support to people who are dealing with mental health and addiction issues? I've heard about some organizations that even provide employment, training. Can you talk a little bit about this?
Yeah, for sure. I mean, every organization is different. That's for sure. Depending on where you go, it's going to be different. But organizations, the peer support organizations and the CSIs are almost always going to provide a safe place to go, a confidential space. But they can support you in what it is that you are trying to do. So in some cases, if you're looking to find a job, you might be able to go into an organization and get support with your resume and with submitting applications. If it's, in some organizations, they're helping people to find secure housing. In other places, they're advocating with their peers to talk to their doctors. Some peer supporters will go to doctor's appointments with people. There is also a program that is called the MAPS program, which is the Mental Health and Addiction Peer Support, which is peer support for people who are on probation and parole, who have been incarcerated, who are coming out and going back into the community. And there are peer support programs that are helping them be able to get back into the community and find jobs and somewhere to live. There are peer support programs that are there for people who have maybe been in the hospital for a period of time and are coming out of the hospital again, integrating back into the community, and really need support with that. In some cases, it's helping someone find, food. There's so many different things and resources that a peer supporter can help you with. And in some cases, it's just really, I've had people who have done our training and are doing their internship, because part of our training is getting hands-on experience. And sometimes you're working with someone who just has a hard time getting out of bed in the morning. So really, it's very individualized what it is that you need support for. But with having a peer supporter, they can kind of help you in most cases with what it is that you're trying to do and where you're trying to get. And then the nice thing is, in so many of these organizations, is that once you've kind of, been on your journey to wellness and you feel that you are far enough along in your journey that you're ready to start giving back, there's opportunity to give back by whether it be a peer supporter or becoming a staff member of the organization. There's so many opportunities to kind of give back once you've been involved in a peer support organization or consumer survivor initiative.
Amazing. Earlier you had talked about people who can fall through the cracks, and you were, mentioning wait times. You did mention that obviously peer support can't reduce wait times for other types of mental health and addiction treatment, but can you talk a little bit about what makes peer support so special in, like, when it comes to its accessibility and when it comes to barriers to mental health and addiction treatment?
Yeah, I mean, I think what we said before is that there's no wait lists at a consumer survivor initiative or peer support organization. Someone can just walk in the door, and there are times where people don't walk in the door, that they stand outside the door because they're just not sure. So nobody is going to, like I said before, there's no referrals. Nobody can make you go. You come when you want to come. You can walk through the door when you're ready. There have been times where people have gone outside and talked to someone until they felt comfortable walking through the door. It is a safe place. It's confidential. The one great thing about consumer survivor initiatives is when we talk about low barrier, part of that is that you don't have to give your name. You don't have to give your health card number. You can use the service very anonymously. And for people who have felt that the traditional mental health and addiction system hasn't worked for them, there are people who want to be able to walk in and not have to provide their names. Consumer survivor initiatives don't have, at this point, it's interesting because at this point, I know the government is starting to institute more data collection so that they can kind of understand the services that people are using. But the consumer survivor initiatives don't even have that software to be able to track people that come into their service. So it's completely anonymous. It's completely confidential. And anyone can use the service and then choose when they want to use the service and not. Because there's no wait list, if you decide that you want to go in and participate for a period of time, and then you find that you don't need the service anymore, and then you find that in 6 months you need it again, you walk through the door again. So it's very easy to use, and there is no expectation that you will use it for a certain period of time. And it's also not diagnosed based, so you don't need to have a diagnosis. You don't need to tell anyone any information about yourself that you're not comfortable sharing.
Okay, so can you tell us a little bit about Warm Lines? I believe this is a service that some peer support organizations operate.
Yeah, so there are a few across the province. So Warm Line is a non-crisis line. One of the things that we have found for a long time, I mean, this is not new, and this is not COVID, even though we did find that COVID did exacerbate people's feeling of isolation. So definitely the need for Warm Lines increased over the time of the pandemic. Warm Lines have been around for many years. Actually, we just had we had a conference back in the beginning of February, and we had an organization present, and we didn't realize that their Warm Line has been around for 30 plus years. But basically what a Warm Line is that it's a line that you can call, and some of them are even open 24 hours when you're just feeling like you need someone to talk to, or maybe you need some resources. If you're in crisis, it's not a crisis line, and they would then, support you, and maybe, if you were in crisis and getting the support you needed. But also times we find that sometimes people just need someone to talk to. So a Warm Line allows for that opportunity for someone to just call and speak to someone. Like I said, at any time. Some of them, like I say, are open 24 hours, and they can just talk to you. They can provide you resources. And then if you're in any sort of crisis or distress, then they may be able to support you in next steps in getting the help that you want to get. But definitely a good option if you're just feeling down and you're feeling like you really need someone to talk to. They're a great resource, because sometimes, there's a big difference between, you don't have to have a mental illness, have bad mental health days. Sometimes, we can all feel, and I think we can agree that over the last 3+ years, there have been times where we just all haven't felt ourselves. And knowing that there are options out there to talk to people who may have been there, and can understand kind of what you're going through is a really nice feeling to know that can always be someone to talk to.
Yeah, certainly. Can you tell us a little bit about how peer support fits in the mental health and addiction sector? Would you say it's an alternative? Would you say it can happen in conjunction with other forms of treatment? How would you like our audience to understand peer support?
I think it's a good question, but it's very individualized. For some people, peer support is all they need. They meet with a peer supporter, they come up with a plan for whatever it is that they are, needing to work on, or something that they might be struggling with. But for other people, it might be in conjunction with other services. I know lots of people who provide peer support or are receiving peer support are also receiving traditional services. They're seeing a psychiatrist regularly. They're seeing a therapist regularly, but peer support is in addition to the work that they're doing. So I think it's very individualized in the fact of what it is that you need. And there are people that start out with peer support and then decide that, you know what, I really could use some additional supports. And your peer supporter can help you connect to those supports as well. Whereas for other people, peer support is really all they want or need. And it could be because, again, like I said before, it could be because they didn't have a good experience with traditional healthcare in the past, and they just want to be able to utilize peer support. And for some people, it's in conjunction. But I think it's a good option for anyone who's struggling and, wants and needs someone to talk to.
So from our conversation, I get the sense that peer support really is such an invaluable part of the mental health and addiction sector in Ontario. And what do you think would happen if, peer support organizations lost the very little funding that they currently have? How would that impact the sector?
I think that it would impact it greatly, because I think that there are a lot of people utilizing the services of peer supporters. One of the things that I didn't mention, and I probably should, is that peer support is not just one-on-one peer support. There's also other options. So in some organizations, they offer drop-in centers. Some offer more formalized peer support where you can make an appointment. Some offer group peer support. So depending on what it is that your needs are, there are lots of different options available to you. I think that a lot of people out there would really struggle and find it difficult if they lost the supports that they were currently receiving from their CSI or their peer support organization. Like I said, it does help to bridge the gap between appointments. If you're waiting for services, sometimes it just helps, as I said, to talk to someone who has been there. Really, if you think about it, how many times have you been talking to someone and they've been through a similar experience, and you're talking to them and they can relate to what you're saying? It just really does validate the way that you feel when you're talking to someone who knows what you're feeling and what you're going through, as opposed to someone who doesn't really know what you're going through, but they're trying to understand. There's definitely a difference. And like I said before, I don't see a setting where peer support wouldn't be valuable. There should be peer support workers in every hospital, in every emergency room. There should be peer supporters. There should be peer supporters in workplaces. There should be peer supporters in, I mean, there just isn't anywhere, honestly, that I can say that I don't see the need to have someone to talk to when we need it.
And what would you like to tell our audience about, like, if our listeners want to figure out a way to support, peer support organizations and CSIs, what can they do? How can they make sure that they get the funding that they need and deserve?
Oh, that's a good question. I think it is important to familiarize yourself with peer support and know what it is and see the value in it and talk about it. We are finding, even though we have been around and a lot of our member organizations have been around for 30 plus years, that there still really isn't a full understanding about what peer support is. There's still so much stigma out there about mental health and addictions. Like I said, we all have days where we could use support. And I think it's important to just kind of know about the services and the peer support services in your area. And that way, when you're talking to people, you can let people know when you're talking to them about the services in your area. Certainly. Because I think it's way more valuable than sometimes what people realize, because I think that there just is not always a full understanding about the benefits of peer support in our communities.
And you found that maybe even the people who struggle with mental health and addiction issues, they might be aware at times of what peer support is, and certainly there's a vibrant peer support community, but outside of that, it's something that very little is known about, even within university programs and different training programs. Peer support there's very little known about it in like the public sphere.
Yeah, and again, I think it depends. There are some universities that have peer support programs. We have actually done some training with some of the a couple of universities in Ontario. So there are universities that do have peer support programs. But there's also a lot out there that don't have peer support programs, that they do probably have other mental health services, but not peer support programs. But yeah, I think that I talk to a lot of people who, when I tell them what I do, their first question is, well, what is peer support? And even though we've been around for a long time, there's still, I want peer support to be a household term. But when you say peer support, everyone knows what peer support is, because I actually, and I'll say this, over and over and over again, that I don't see a situation in which peer support can't be utilized. We could all at times benefit from having someone to talk to who can understand what we're going through.
We certainly can. Well, Allyson, thank you so much for an incredible conversation and for all of your insights on peer support. If there is one last thing that you want our listeners to walk away with, what would it be?
Kind of what I said. Seek out and check where your local peer support organization is, and learn about the organizations that are available and the services that are available. And also, just to be kind to people. We all could use a little bit of kindness towards us every day.
Okay, wonderful. Thank you so much.
Thank you for having me.